Hello, welcome back to the channel. Today we have a pressing issue to discuss, the South African government's admission that it doesn't know how many foreign nationals are using the country's public healthcare system. Stick around until the end, where we'll provide sources for you to verify this information yourself. In a recent revelation, Action SA disclosed that the Department of Health does not track whether patients in public healthcare facilities are South African citizens, documented foreign nationals, or undocumented individuals. This information came to light through a parliamentary reply to a question posed by Action SA. The lack of data collection means that the department cannot account for the full scope of service delivery liabilities, raising concerns about the strain on the public health system. This revelation has sparked debates across the nation. Some argue that the influx of foreign nationals into South Africa's public healthcare system is placing undue pressure on already strained resources. For instance, former Health Minister Aaron Motsoaledi stated that over 70% of births in hospitals in the Gauteng and Limpopo provinces were to foreign nationals, particularly from Zimbabwe. This statistic highlights the significant demand placed on public healthcare facilities by non-citizens. On the other hand, the health professionals emphasize that hospitals and clinics cannot be expected to treat patients based on their nationality. Dr. Mvuyisi Mzakwa, a chairperson of the South African Medical Association, pointed out that clinicians are not immigration officers and should not be tasked with determining a patient's citizenship status. The primary focus should be on providing medical care to those in need. The government's stance on this issue has been inconsistent. In 2019, a National Health Department circular instructed clinics and hospitals to begin billing foreign nationals the full rate for public health services. However, this directive faced legal challenges from organizations like Section 27, which argued that it violated the National Health Act by potentially withholding services from patients based on their immigration status. Currently, the National Health Insurance Act, enacted in 2023, outlines eligibility for healthcare services. It states that South African citizens, permanent residents, refugees, certain categories of individual foreigners, and all children are eligible to receive healthcare services purchased by the fund. However, the implementation of this act and its impact on foreign nationals' access to healthcare remain subjects of ongoing discussion. The lack of data on foreign nationals utilizing public healthcare services complicates efforts to address these challenges effectively. Without accurate information, it's difficult to assess the true impact on resources, plan for future needs, or implement policies that balance the needs of citizens and foreign nationals. In conclusion, the absence of tracking foreign nationals' use of public healthcare services in South Africa presents significant challenges. It hampers the ability to make informed decisions, allocate resources appropriately, and ensure equitable access to healthcare for all. As this issue continues to unfold, it will be crucial for the government to establish comprehensive data collection systems and engage in transparent discussions to address the complexities surrounding healthcare access for foreign nationals. All images used in this video are for illustration purposes only and are not connected to the actual events or individuals mentioned. Sources for this information include Action SA's press statement, reports from the South African Medical Association, and coverage from various South African news outlets.